staring, but I'm focused on you, and it keeps me from caring. I am here in this now, you're my own, I'm not sharing. And I move through the waves, through these rushes I sway. Within myself I arrive, and I roar so loudly I shake. In this power I quake, my breath breathing down.
Hey, my name is Liesel, and I'm a labor and delivery nurse from Raleigh, North Carolina. I've been a labor and delivery nurse now for about 4.5 years.
Hey guys, my name is Becca Murrell. I am a registered nurse, work on a labor and delivery unit. I am also a student to become a certified nurse midwife.
This week, we're going to talk about hospital births and labor and delivery nurses. We've seen birth at home, we've seen birth in a birth center, so now let's talk about hospital births. I had a very traumatic hospital birthing experience, but that doesn't mean that I don't respect those who work in hospitals. That doesn't mean that I don't think that hospitals are necessary places for emergencies. That doesn't mean that I don't agree with people who choose to have a hospital birth. I want to share more about what these nurses do, because I don't think that I really understood what would happen when I went into the hospital. In this video, we're going to hear from two very awesome labor and delivery nurses. Both of these nurses are on social media and they're very passionate about birth. Thank you so much, Becca and Liesel. All of their links will be in the description. If you're a birth nerd like I am, please check them out. If I ever gave birth at a hospital, I would definitely want both of them on my team.
Labor and delivery nurses don't work at hospitals, they work at birth centers, but most of them work at hospitals. And I am just basically a nurse who cares for patients who are either in labor or they're coming to find out if they are in labor through triage. They're on antepartum, they're being hospitalized during their pregnancy for pregnancy-related complications. Mainly, I take care of patients during labor.
A labor and delivery nurse is a nurse that takes care of patients during the childbirth process. I work on an LDRP unit, which basically means that I take care of patients both in labor, birth, C-section, triage settings, antepartum settings, and postpartum settings. So we kind of do it all on my unit.
So a typical day probably consists of me, clocking in on the floor and getting my assignment. At our hospital, we do a 1-to-1 ratio when patients are in active labor or if they're high risk at all, so they have an epidural or they're on Pitocin at all. Otherwise, it would be either 1-to-2 or 1-to-3 if you're in triage or you're on antepartum. And yeah, from there, I get my assignment and I start caring for the patient, in whatever part of labor that she's in. I care for her at that point. Some of the things that I do are monitor fetal heart rate strips and making sure baby's looking okay on the heart rate monitor. We help with position changes, we give medications, we do vital signs, we assist with C-sections, we set up delivery trays, I manage Pitocin drips. There's a whole bunch of stuff that I do in a day. It just kind of depends on what kind of patient I have and what kind of assignment I have.
Typical day at work for me depends on what my assignment is for the day. Some days I am serving as a charge nurse where I kind of make patient assignments and I'm kind of like the shift leader for the day. Some days I take care of patients while they're in labor and giving birth. Some days I take care of patients in a postpartum setting, triage settings, and some days I am a part of cesarean births as well. But as a general rule of thumb, for the day, I am just responsible for taking care of my patients and giving them medications, supporting them if they're in labor. If they're postpartum, I support them with breastfeeding and things like that. Serve in whatever way that I can to help families to follow out doctor's orders or midwife orders and pass medications and things like that.
Birth plans do kind of get a bad rap nowadays because people say, oh, don't make them too long, don't make them too elaborate, blah, 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 which is sort of true. I'm more for talking to your provider before you sit down and actually write your birth plan, because you might find that a lot of the stuff that you want on your birth plan is something that you don't really need to write down because it's something that we do already. Like, for instance, skin to skin. Most places nowadays are very, very skin to skin friendly. So it's not something that you necessarily need to write on your birth plan.
I love birth plans. As a nurse, I love when my patients come in and just give me a sheet of paper and say, this is what I want. I sit down with my patients, one of the first things when they get admitted, if they have a birth plan, and we go over in detail like what they want and what their expectations are. I'm sure people have heard this said before, but my one suggestion about birth plans is to be flexible. So we know that things with birth can change at any second. 9 times out of 10, it's normal changes, not like emergency situations or anything like that, but emergencies do arise as well. So I would just say, do your research, have an ideal situation in your brain, but also know the things that you can live with. I actually have a podcast episode with Sarah Schweiger, and she is the creator of the Birth Plan Co., and she sells visual birth plans. And in her episode, she shares that for her physiological birth plans, she also shares a little section that is called in case of a cesarean. So people can really fill out, if things don't go as planned, what would they want in that case?
I would be helping mom with position changes if she's feeling like she wants to push on hands and knees or squatting or, lithotomy, whatever. If it's time to call the doctor and the doctor's comfortable with her, delivering how she's pushing, whether it be hands and knees or squatting, then we just kind of stay in that position. If not, if they're more comfortable with her in lithotomy, then I kind of break down the bed and get her into that position. And that is something to talk to your provider about, because some of them do have preferences. So if that's really important to you to be able to deliver on hands and knees or squatting, just make sure that that is something that you talk to your provider about. First thing I would do is kind of get them into the right position. Before that, I'm kind of pushing with them. That's one of the main things that we do is we push with patients for however long it takes to push your baby down. That is something that is a big role of ours, is pushing with patients. So once we get to the point of calling your doctor or your midwife, then your doctor or midwife comes in and we kind of get you into position, however position you want to deliver. We put a big old drape underneath you to kind of catch blood and bodily fluids and stuff. And I would already have the delivery tray kind of set up next to you for the provider. If they need any instruments during your delivery, on the delivery table, it has like a little gown for your provider. It has a little bucket for the placenta. It has a bunch of instruments for the umbilical cord and clamping the umbilical cords, and kind of clamping the placenta. There's like a whole bunch of instruments that can be used. Not all of them are used. You might be hooked up to IV fluids or your epidural, and right after delivery, I kind of cut those off. After the cord has been cut and clamped, I would start a Pitocin drip, and that helps to just kind of contract down your uterus and helps with your postpartum bleeding. And it also helps to prevent any postpartum hemorrhages. So that's pretty standard and routine in the United States. I'm checking your vital signs. I'm pushing on your fundus, which is the top part of your uterus, to make sure that your uterus is contracting down, checking baby's APGAR scores, and just making sure baby's okay. And then from there, if you would need any stitches, we kind of get supplies for the provider to stitch you up, unless sometimes we have a tech or a nursing assistant in there to help with that, kind of clean you up and kind of get you sitting back together after birth.
The hardest part of my job by far is, I would say, two things. Number one is patients who have stillbirths. Of course, that's always hard, and fortunately, they don't happen terribly often, but when they do happen, they're just very tragic. They take a lot out of everybody involved, and I still remember the names of all of the babies that I have helped bring into the world sleeping, and it's one of the hardest parts of my job by far. And I would say that the second thing that is very difficult is when patients don't have the deliveries that they expect. Things that turn out to be kind of traumatic or disheartening to them, and that's always difficult. My goal as a nurse is to always try to help people have the deliveries that they want, and to help, make sure that both mom and baby are healthy in mind, body, and spirit. And sometimes no matter how hard you try, things just don't go exactly as we plan. Most of the time they go pretty well, but sometimes it's like, gosh, no matter what we do, things just don't turn out exactly quite right. And that's always really, really difficult. And I would say the caveat to that is the most rewarding thing is when I have patients that do get the delivery of their dreams, or just people feeling really supported by me. That is always super rewarding. When I take care of patients, especially in labor, I feel like I get to really support them and get to know them really well. And sometimes I come back the next day to work, or the next couple days to work, and I go and I see my patients that I had in labor with their baby and things like that, and they just say things like, "Thank you so much. I really just feel like I couldn't have done it without you." Ultimately, at the end of the day, I know it wasn't me, it was them, but it does feel really, really good. I'm actually feel like I'm gonna cry right now just talking about it. That is what I love the most about my job.
We are usually a pretty well-oiled team when there is an emergency happening, because we've been through training for these certain types of common emergencies that we see, like a shoulder dystocia, baby's head kind of gets stuck on the way out, or a postpartum hemorrhage. We've been through drills, so we know exactly kind of what to do and kind of the steps that we need to take. And there's usually a lot of people in the room, and everybody kind of knows their role. It's just about kind of taking on that role that you are assigned to in an emergency, and it's kind of a not spoken role, I guess. Like, if I'm already kind of charting, I'm just going to continue charting. If I'm already, doing fundal pressure, I'm going to keep doing fundal pressure, whatever it may be. Many times in these emergency settings, that is what happens, and that is why sometimes emergencies don't go the way they should go. Something that we're really focused on too in our training is being able to communicate with each other effectively, and communicating very clearly with each other.
Oh baby, I know this is not what we planned, and it's all just a blur, but I'm still the
Going into a hospital birth, I want to know everyone's role, and maybe you do too. I want to know who's going to do what, and who's going to be where, and what's going to happen, no matter where you give birth. If I was at a birth center, I would want to know the same thing. I hope you all enjoy my video. Let me know how I'm doing in the comments. I want to help prepare you all for whatever birth setting that you're going to be in.
I've always been really passionate about birth ever since I was younger, and especially during nursing school. Social media has grown so much that, why not start something on social media and really start to educate patients on social media? Because let's be honest, that's where we spend a lot of our time.
Sharing on social media and educating people was a way to do my part of helping other people have more empowered birth experiences. And so for me, being able to educate people online was a way that potentially I could touch somebody else, that their birth would go the way that they wanted it to.